It's a wonderful privilege to be able to collaborate with our community and recognize nurses. Nurses are a part of the community. They live in the community and they care for the community members as they need health care. The benefit is that nurses get to help with prevention of health care, to help people stay healthier, and then also to take care of them when they have an acute need or a health crisis. Nurses are always going to be there.
I think the first characteristic that you need to be a good nurse would be the compassion to help others out. When asked, most nurses would tell you that the reason they got into nursing was to really help others in some way. And then you have to combine that with a great skill set as well as knowledge and almost a scientific thought pattern about how you go about helping others out in the healthcare industry. But nursing has a great variety of things that they can be doing, and the many options for nursing that we didn't have previous to the past probably 10 years. So there's a tremendous amount of opportunity and skill sets that are associated with those opportunities. But I think a real strong desire, compassion to help others is really huge.
I think this year more than ever it's important for us to be honoring nurses, both here locally and certainly across the globe. Nurses have stepped up to take care of our COVID patients and have also witnessed death during this tragic period of time. I honor nurses today and every day and look forward to coming out of this pandemic and realizing that there will be something in the wings waiting for us, but I know that nurses will respond quickly and accurately.
I'm Rini Schwally, and I've been a nurse with Lumina Hospice for 18 years now. Lumina Hospice, we're an organization to help people at the end of life. I love my job because I have the opportunity to make a difference in people's lives. It's such a crucial time in a patient and a family's life that to have that opportunity to give them comfort and guidance during this time and allow a peaceful death. I feel blessed to have been able to be involved with this organization, primarily because we have an awesome team, and it has been a team. I couldn't do my job without all the support from every different level. The COVID pandemic has provided just all these new challenges for us. But we are going to look back on this as a very important time and how we have been all able to come together to do our job. So it's been an honor and a privilege really to be part of it.
My name is Aslan Noakes. I have been a nurse for almost 11 years. For our main campus testing, which is called Trace OSU, people are invited. So our folks living in congregate living, like folks in our dorms, are required to come weekly for testing. So they present with the QR code. A student that's working at our facilities here will hand them a barcoded tube and walk them through the self-collection process of giving a nasal swab sample. I think my favorite thing about being a nurse is being an advocate, to go in there to provide resources, to help meet needs as they come up. When we were doing Trace Community door-to-door testing, even if someone was not willing to participate or unable to participate, we still gave them a whole bundle of resources and let them know where they could get assistance with food, housing, things like that. And it was cool just to check in with our neighbors here in our own community. It's been really exciting to be part of public health nursing in Oregon. I do a lot of public health nursing in Haiti, where I do a lot of global health work. For a while, we were running a small hypertension management program in 2 rural communities, but to be able to do public health nursing here in my own home state has been really rewarding.
My name is Jamie Bryant, and I've been a nurse at Samaritan Albany General Hospital for the last 30 years. Within the first few minutes of meeting someone, they can tell that you're going to be a good nurse. And if you take good care of people, the word gets out there. And so people, they'll come to the hospital and they'll ask for me by name. Being a male in the labor and delivery field, I thought that I would get refused more than I have. But the community here has just been overwhelmingly in support of me and supportive of me, and my wife and kids have all been supportive of me. So yeah, it's been a good career. You know, the favorite part about nursing is you get to deal with people on a one-to-one basis in labor and delivery. And to me, that's where nursing is at, making that bond between you and your patient. And to me, coming to work, being able to step into a room and immediately get that bond created, that to me is all what nursing is all about.
I'm Cindy Van Meter, and I've been a nurse for 7 years now. I do love it. It's actually been a childhood thing to be in the medical field. Being a vet myself after 9 years in the military as a hospital corpsman, when I returned from Kuwait, the vets of the generation that we serve now in hospice and palliative care were the ones that were there for me when I came back to make sure that we got the thank you. So now in return, I get to thank them through our We Honor Veterans program in Lumina Hospice. We pin them, we give one of the Mary Rivers quilts, and just a thank you to let them know before they pass that we do thank them as a country and as people here in the community for their service, that what they provided for us and our safety. I love what I do, which just comes out in how I do it. I'm there for the patients. I'm not there for anything else other than to make sure that they get the care that they deserve.
My name is Amy Dale. I've been a nurse since 1993. I work in intensive care. We have the sickest of the sick. It can be hard at times when you have a lot of people that pass away and you have families who are having problems coping with that, and that can be very stressful. Sometimes you take that home with you a little bit, so you have to find outlets at home to have your mind think about some other things, but sometimes it's hard to see so many people die. I just really enjoy helping people, and you work real close with the physician in the ICU, so we're kind of a team, and I'm part of that team, and I feel very much that's what I am here, like part of the team. We're all important, and it makes me feel good when I've helped somebody and I touch them and they thank me, and it makes me feel like I've done something. It's very fulfilling that way.
I'm Amber, and I'm an RN. I've been at Good Sam for 18 years. Nursing is something that I always wanted to do. I don't remember wanting to ever do anything else. I always just kind of knew that was something I wanted to do. I just have a passion for helping people, and I wanted to make a difference, and I felt like nursing was a way I could make a difference. On a small scale, but I think even small differences can make a big difference. It's been a crazy year, but it's been a great year. There were so many unknowns, and we weren't sure what to expect and what was going to happen and how everything was going to go, and you just kind of had to go with the flow and take it day by day. I've been in the ER for the past couple years, and I love it. I love the variety. It's challenging, it's rewarding, it's fulfilling. It's just been wonderful. I've learned and grown tremendously. Patients, thank you, and it's just nice to try and help.
My name is Cassidy Froman, and I've been a nurse for almost 6 years. It's the best. I love the fact that I can help people and that you just get to be an important part of somebody else's life. The biggest challenge that we have had is that I cannot let a single family member in the door, and that we don't have very much visitation inside because of COVID. And we've lost our volunteers. But window visits are important, and we've tried to improve our activities and things like that to make sure that people are not bored. But it's hard. It's brought our team closer together, and that we're all in this together, and we've done a really good job of trying to make everything as bright as we can for all of our patients and residents. And we're celebrating the little things. Superhero Day is coming up later this month, and so we're doing Superhero Day.
My name is Jessie, and I have been a nurse since 2014. And with hospice nursing, we followed the whole story, right? From beginning of admission, you're that RN case manager. I'm managing your medications, your symptoms, your equipment, your supplies, the rest of the team, making sure everyone's all together. Family matters, and then patient passes, and even after that, you still call family. When COVID first started, nobody knew what to do. Sometimes you have, patients who didn't get to see anyone except for their nurse once a week. So that was very challenging, and we saw a lot of, issues with some of our patients because they were so lonely. I guess I've always kind of been like an acts of service kind of person. I feel very, honored and rewarded when I take care of someone and they're thankful for it, and I know that I helped them.
My name's Ashley Morelli. I've worked here at WVCI for about 3 years now. The best thing for me about this job is that I get to form long-term relationships with my patients. I get to work with them over several years. I get to know them. So just kind of having that trusting relationship is so awesome to me. That's what makes it worthwhile. Often we'll still follow someone maybe on a yearly basis after they've completed treatment, and that's the best feeling, is seeing people when they're sick and at their worst, and then moving forward to just thriving and living life. That's the best. To put it shortly, it gives me the warm fuzzies. I make lots of friends here. I love my patients. We get so close. And that's what it is for me, is of course it feels good to save the life of a stranger, but when I've gotten to know someone and kind of form a friendship over a few years, and then I see them thriving and kicking butt, it's awesome.
My name is Mo Weinman, and I've been a nurse for 9 years. Being a nurse is pretty exciting. Never have the same day twice. I work in critical care, and in addition to that, I also teach clinical to second-year nursing students on the same unit. And it is just really filling me in a way that I haven't been filled before. The excitement from the nursing students to provide care to a patient is kind of infectious, and I'm just really loving it.
How was it being in the critical care environment with the pandemic this last year?
That has been interesting. We didn't have a lot of warning before it came here, at least as nurses we didn't. So it was kind of learning on the fly with recommendations from our hospital administrators and the CDC, and just trying to do the best that we could for both the patients that were coming in for COVID and the other types of patients that we get. I'm really proud of us. I think we did a good job. We're doing a good job.
My name is Tammy Hewitt, and I've been a nurse since 2017. I love it, especially hospice nursing. It's the only nursing that I've ever wanted to do, and there's no place like home, and that's comfort. And so to be able to provide that and make that a reality for people, I think is extremely important. Even though the barriers of COVID are there, initially it may feel a little bit awkward, but when it comes down to it, you're still able to connect. After a while, those things seem to disappear. What I get out of this career is peace and fulfillment, just knowing that I'm making a difference for patients and their families at the end of their lives.